Okay, we're now going to do a treatment to give you a picture of the hand movements. The methodology, I have it set on 3 again. The methodology is back and forth in overlap passes without lifting the handset from the skin. Every time you lift the handset from the skin in microdermabrasion, you lose about 6 feet of crystals, because that's how long the hoses are. And so the name of the game is to keep the handset on the skin the entire abrasion if you possibly can. Normally, as I do an abrasion, I lift the handset off the skin between 4 and 6 times in the entire treatment. So I've started up in the forehead and I'm working down and I haven't lifted the handset 1 time off the skin. I'm overlapping each pass in constant overlap strokes. The secret of microdermabrasion is to do constant passes and make sure that you do all of the skin. And you get so that you recognize the difference in the skin, and you can actually see the color change in the skin as you abrade each area. Okay, so I'm back up here at the forehead, and I went clear around the face, including the mouth and the lips. And now I finally lift the handset off. Now I'm going to lower the pressure a little bit so I can abrade around the eyes. There we go. Around the eyes, I do single strokes right up next to the eye, and then I do the normal pattern back and forth, overlapping each pass. The nose, you just abrade the nose in all areas. You don't have to press down with the handset. 2, 3, and back on. And there the whole face is abraded. Now we're going to do aspiration. And I'm going to start the aspiration down on the neck, because the neck always needs to be aspirated, even if you don't abrade the neck. You always need to aspirate the neck. What that does is it causes more blood to be in the neck, which means we get fibroblast and collagen and elastin, and it keeps the tissue firmer on the neck. There's no crystal being used now, and so we don't really have to worry too much about staying on the skin, because we're not having any crystal wasting. But I always maintain the same method of movement, whether I'm doing aspiration or microdermabrasion. Aspiration is blowing air caused by the vacuum of the system. The abrasion is blowing air with crystals in the air stream. Okay, now we're going to turn the pressure back up. To just a little bit higher than we did the abrasion. And now I'm going to work right on up to the forehead on the face. Aspiration in the short term is more important than the abrasion because we're pulling a lot of blood up into the tissue. That blood in the tissue increases fibroblast and causes the cell structure to produce collagen and elastin right away. And so the person you're working on, their skin will actually be changing before they get off the table because of this aspiration. Whereas the blood that's brought into the system by the immune system doesn't arrive for about another 6 to 8 hours before that starts to happen. And so this little burst that we put into the system with the aspiration actually starts all of the healing process early. When the treatment is over, all we have to do is turn the machine off. There's nothing else to do on the machine. The only part of the machine that's being contaminated is the application cap itself. Nothing else is being contaminated by this treatment. Okay, so there we are. All we have to do, turn off the aspiration, turn off the machine, hang up the handset, and we're finished.